James Ward. I'm an associate professor in the infection immunity theme at the South Australian Health and Medical Research Institute. Predominantly my area of research is working in the infectious disease area, so predominantly sexually transmissible infections, viral hepatitis and HIV. I guess I had a natural tendency for research. I quite liked some researchers around me at the time, and I thought they were doing great work, and I thought I wanted to move into research. In many of Aboriginal and Torres Strait Islander communities, particularly the more you go remote, the burden of disease related to STIs and Blood Borne Viruses is greater. Rates of chlamydia are around 5 times that of non-Indigenous people in remote areas. Rates of gonorrhea are up to 30 times higher than for non-Aboriginal people in those areas. And hepatitis B is endemic in many remote areas of Australia. And we've got this really impending threat of HIV increasing in Aboriginal and Torres Strait Islander communities, which it never has in the last 30 years. We're working with 5 clinical hubs around Australia to try and work out what we can do better in health services. So the big thing we're trying to do under that project is establish a national sentinel surveillance network of around 40 to 50 Aboriginal health services. And so once we get that network up and running, we'll have a much better understanding of how to drive improvements in clinical practice. And we think the clinical guidelines currently available to address STIs, particularly in the remote communities, are not potent enough to bring down the prevalence of these STIs. So we're hoping to get some really good evidence to improve clinical guidelines or shape clinical guidelines into the future. NHMRC is our bread and butter, and I think NHMRC expect high quality level research with a lot of integrity and with rigour, and I like that. If you're looking to apply for an NHMRC grant, do it as early as possible. Don't try and ring around communities at the last minute to get endorsement to put in an application. I think you've got to work very solidly with communities, talk to them about through the issues, put forward your proposal. Ideally you want the proposal to come from community, but I think putting forward a coherent narrative around what you want to do with scientific rigour will get you over the line, and I encourage anyone to do it, because it's just not going to be government who can fix up the gap in Indigenous health. It's research, it's government policy, it's community organisations, and all of us working together need to contribute to closing the gap.